In this video, we'll discuss about ventilator associated infection bundle of care. We have hand hygiene, elevation of head to 30 to 40 degree, include suctioning technique, ventilator management and oral care. First one is hand hygiene. Single most cost effective way, this one is the cost effective way of preventing the spread of infection is no other than performing proper hand hygiene that is supported by various studies. According to research on proper hand hygiene creates significant decreases on ventilator associated pneumonia among patients admitted at intensive care unit on ventilator support. So simple hand was reducing the spread of infection. The next management as part of that bundle is the head elevation at 30 to 40 degree. Patient position is vital in ensuring ventilator associated pneumonia prevention. According to research, mechanical ventilator according to research, this mechanical ventilator assisted patients that are maintained head elevate the T cooler even 30 to 40 degree angle. Then decreased case of acute ventilator pneumonia, proper head elevation, secretion from collecting from subglottic area. It also prevent aspiration of fluid from patient stomach. So head elevation 30 to 45 degree angle. The next bundle component in our suctioning technique. Under this, we need to understand that there is no specific schedule needs to considered when it comes to suctioning. We need to perform proper suctioning when there is a clear indication. And what are these? We need to immediately shuck, suction the patient when there is an increased or visible secretion. Okay, first one is what is the things, no specific scheduled, okay, no specific time suction need to perform proper suctioning. Second one is the patient when desaturation occur. Desaturation might be indication that endotracheal tube are clogged due to accumulation of secretion. Lastly, suction the patient if there is a coarse breath sound. Okay, coarse breath sound. The breath sound might be an indication that lungs functioning was disturbed due to multiple underlying reasons such as adult respiratory distress syndrome ARDS, asthma, pulmonary edema, and lot more forward. The next things that we need to ensure is saline directly to endotracheal tube is not recommended. Infusing or injecting saline on endotracheal tube is considered. So, injecting saline on endotracheal tube is considered, and practice was performed before setting the idea that it will help secretion. But this is the wrong implication. Installing saline as a practice can cause aspiration and need lungs infection. Once fluid passes through our patient lungs, the best thing to do that endotracheal tube. Healthcare worker need to ensure that suctioning which clean indication was performed, which with a clear indication was performed. Next one is preventing this ventilator associated pneumonia preventing method. So in this one is it is important to separate suction equipment, oral and endotracheal tube suction tips. Giving emphasis on suction tube, we need to take note and apply the following. Use two separate, okay, use two separate tubing for oral and endotracheal tube. We use two separate tips for oral and endotracheal tube. Then ideally change that suction tube every use, both both for oral and endotracheal tube. Then maintain suction tube tips dry and clean. Then use sterile saline and suctioning. So what are the things? To separate tube used for oral and endotracheal tube. Then change that suction tube every use. After that maintaining suction tube dry and clean. Then use sterile saline. So it is recommended for us to use wide mouth container or glass or sterile saline. In addition, ensure that salining container is clean and dry and new. Next, in ventilator associated pneumonia, management, bundle management is part of that bundle is the ventilator management. The device or even that machine itself is important to consider, because if ignored its extensions, this may lead to our device related infection. These are the things need to be considered, and this is the vital. We need to change that ventilator circuit only when it is visible solid that circuit is malfunction or damage. So we can change that ventilator circuit only when visible or any damaged condition. Second, we need to maintaining the closed system approach again is golden rule in prevention and control of infection. The more that we exposure this item, the more we attract and allow that microorganism and bacteria to enter. Third, condensation shall be trained away from that patient. This management prevent that contaminated fluid backflow to patient. And lastly, mechanical ventilator must be clean, disinfectant and sterile without fail, and this must be stored properly. All respiratory equipment must be provided by dedicated storage area. In addition, as healthcare worker, we need to ensure that all the delivered ventilator support and that management that will complete the part of that whole for our ventilator associated infection. Next one is oral care, because device such as endotracheal tube was usually placed in our patient mouth, and giving emphasis on how we will prevent infection is a must as healthcare worker. The things that we need to ensure and perform all the following. One of the key element, we need to clean patient oral mucosa using antiseptic solution. Oral cleaning with chlorohexidine 0.12 percentage twice daily. Chlorohexidine 0.2 percentage twice daily. According to research, ICU patient on sided ventilation via endotracheal tube when oral care was performed using 0.12 percentage solution chlorohexidine, significant decreases on ventilator associated rate was determined. During oral care is also important that we able to remove biofilm. Okay, we able to remove biofilm to prevent bacterial colonization that leads to lungs infection. Lastly, we need to apply moisturizer to prevent oral mucosa and lips to keep moisture at needed. You can never go wrong when you combined hygiene and proper maintenance.